Imagine this, a healthcare system where, seeing a doctor doesn't break the bank
Right.
and getting specialist care isn't like navigating some huge maze.
Uh-huh.
And pretty much everyone actually gets the care they need. Sounds almost impossible, right?
It does sometimes. But today we're actually diving into Taiwan's national health insurance system,
Hmm.
the NHI.
To see how they seem to have pulled it off.
Exactly. It's a system that really gets attention globally. People talk about its cost, its efficiency,
Yeah.
how easy it is for people to access.
So our mission today for you listening is to unpack how it works, look at what makes it, well, unique.
And we'll also pick up some useful English vocabulary about health and medicine along the way.
Great. So let's start right at the beginning. What exactly is Taiwan's NHI?
Okay, so in simple terms, it's a single-payer system. They set it up back in 1995.
Single payer. What does that mean in practice?
It basically means there's one main organization run by the government that handles everything.
Right.
It collects the insurance premiums, the payments people make,
Oh.
and then it pays the hospitals and doctors for most of the healthcare services, instead of lots of different private companies.
Okay, that already sounds quite different from, say, the U.S. system.
It is, fundamentally.
So what are the big advantages then for the average person living there?
Well, there's several key benefits. First, universal coverage. That's a huge one.
Universal meaning everyone.
Pretty much, yeah.
Yeah.
Almost all residents. And that includes foreigners, too. If they have residency status, they're covered.
Wow. That must give people a lot of peace of mind, just knowing you're covered.
Absolutely. It's a massive safety net.
Yeah.
Then there's the cost.
Ah, yes, affordability. You mentioned that.
Right. When you go get treatment, the fee you pay right then and there, the copay, it's
Yeah.
generally quite low, very affordable for most people.
Okay, low copays. What else?
Access, how quickly you can get care. In many situations, you can actually go straight to a specialist.
Without needing a referral, like permission from a regular doctor first.
Exactly. In many cases, you don't need that extra step, which can save a lot of time and hassle.
That's quite surprising. That's often a big hurdle elsewhere.
It definitely streamlines things. And one more thing, it's very digital.
Digital how?
Your health records, your insurance card information, it's largely electronic, which, just makes the whole process run more smoothly.
Okay, so universal coverage, low cost, fast access, digital records. It paints a good picture. And I actually saw something about this. Taiwan ranking really highly.
Ah,
Yeah.
yes. You might be thinking of the CEO World Magazine's Healthcare Index. For 2024, they ranked Taiwan #1.
Number one in the world. What were they looking at?
Things like the quality of care, obviously, but also efficiency, how affordable it is, the actual infrastructure, hospitals, clinics, that sort of thing.
Yeah.
Also, overall cost, availability of medicines, and even how ready the government is for health emergencies. It's quite comprehensive.
That's impressive. It really makes you wonder, what exactly does this top-ranked system cover?
That's the logical next question, isn't it? What do you get for your premium?
Exactly. If you're in the NHI system, what services are included?
It's pretty broad. It covers your standard doctor visits, whether that's your family doctor or a specialist.
Okay.
Hospital stays are covered if you need to be admitted, and surgeries, too.
What about things like dentists or alternative medicine?
Good question. Yes, dental care is included in many cases, and even traditional Chinese medicine treatments are often covered.
Really? TCM as well?
Yep. Plus, prescription medications, the drugs your doctor orders for you, are generally covered. And preventive stuff, too, like vaccines and health checkups or screenings.
Wow, that sounds like almost everything you'd need. Are there things it doesn't cover? Any major gaps?
Like most systems, it has limits. For instance, purely cosmetic surgery, things done just for appearance, usually isn't covered.
Makes sense.
And some over-the-counter drugs, the ones you can just buy yourself without a prescription, aren't typically included either.
Okay.
Oh, and if you want, say, a private room in the hospital instead of a shared one, you often have to pay extra for that upgrade.
Right. Those seem like fairly standard exceptions. So we know the system looks good on paper, ranked highly, covers a lot. But what's the experience like for people, especially foreigners? What do expats say?
The feedback you hear from expats living in Taiwan is overwhelmingly positive, really.
What specifically do they like?
They often mention three things. It's quick, it's affordable, and it's transparent.
Transparent, meaning it's clear what things cost.
Exactly. They appreciate knowing upfront what they'll likely pay without hidden charges or complicated bills later. That's often a big contrast to what they're used to.
Yeah, healthcare billing can feel like a black box in some places.
Totally. And many expats directly compare it to experiences back home, especially if they're from somewhere like the
Ach
U.S.
so.
They talk about the long waits they might face elsewhere to even get an appointment, let alone see a specialist. And of course, the potentially massive costs.
Right. The sticker shock for healthcare in some countries is real.
It really is. There's this kind of typical story you hear from expats in Taiwan.
Like an anecdote.
Yeah, something like, I wasn't feeling well, so I just walked into a clinic, saw a doctor, got a diagnosis. They gave me a prescription right there. I picked up the medicine. The whole thing took maybe 30 minutes.
30 minutes, start to finish.
Often, yeah. And they'll add, it cost me less than 300 new Taiwan dollars, which is, around 10 US dollars.
Wow, okay. That really paints a picture. Quick, easy, and incredibly cheap.
It sums up that efficiency and affordability that just seems remarkable to many newcomers.
It definitely does. Now, speaking of understanding all this, part of our goal here is also to help you, our listeners, build your English vocabulary around these topics.
That's right. Knowing the right terms makes it much easier to talk about or understand healthcare wherever you are.
So let's go through a few key terms that came up. First one, health insurance.
Okay. Health insurance is simply the plan or the system that helps pay for your medical costs. It's that protection. So an example sentence would be, Taiwan's health insurance system is government run.
Got it. Health insurance, the overall plan. What about that fee you pay at the clinic?
Ah, that's the copay. A copay is the fixed amount you pay out of your own pocket when you receive a specific medical service.
Like that NT $300 example.
Exactly. So you could say, my copay for seeing the doctor was only NT $200.
Okay, copay. What about the doctor's note for medicine?
That's a prescription. A prescription is the official instruction from a doctor that lets you get medication from a pharmacy.
Right.
So, an example. The pharmacist filled my prescription in 5 minutes.
Prescription. Got it. Now, you mentioned not always needing permission to see a specialist in Taiwan. What's that permission called usually?
It's a referral. A referral is basically a letter or official recommendation from your main doctor sending you to see a specialist.
Okay.
So you might say, in some countries, you need a referral before visiting a specialist.
Unlike Taiwan, often. Referral. What if you go to the hospital, but just for a test or quick procedure? No overnight stay.
That's called outpatient care. Outpatient refers to any medical service where you don't need to be formally admitted to stay overnight.
So like a clinic visit or a day surgery.
Exactly. An example sentence. I had an outpatient visit for my allergy test.
Okay, outpatient. One more. How do we talk about what the insurance includes?
That's coverage. Coverage refers to the range of services and treatments that your health insurance plan actually pays for.
So it defines what's included under the plan.
Precisely. For example, my dental cleaning was covered under NHI. It was part of my coverage.
Great. So quick recap. Health insurance, copay, prescription, referral, outpatient, and coverage. Hopefully defining those helps you understand these kinds of discussions better.
Definitely. And when you put all these pieces together, the structure, the benefits, the coverage, the experiences, Taiwan's NHI really does emerge as a fascinating model.
Yeah, it seems to strike a balance between keeping costs down, maintaining quality, and making sure people can get care quickly.
It's not perfect, no system is, but it's often held up as proof that universal healthcare can work, and work efficiently.
It seems like something that both locals and expats there really value.
Absolutely. That accessibility and affordability consistently come up as major plus points for living in Taiwan.
So it leaves us with a thought, doesn't it? As you've listened to this deep dive, think about the healthcare system you're most familiar with. What parts of Taiwan's approach seem most different, maybe most surprising, or perhaps even relevant?
Yeah, what aspects really stand out in comparison? Definitely something interesting to reflect on.